Hello, family and friends, and thank you for joining me. April is Alcohol Awareness Month, and today I want to talk about a growing but often overlooked crisis, the rise in alcohol use and misuse during and after the COVID-19 pandemic. Even before COVID hit, alcohol was already a major public health issue. According to the CDC, excessive alcohol use causes over 95,000 deaths every year in the US. That's 261 people every single day, making it a leading preventable cause of death in the country. Then came the pandemic, and things got worse. Blue Cross Blue Shield conducted a national pulse survey that showed a 23% increase in alcohol use since the onset of COVID. But why did this happen? Well, if we look at the past crises like 9/11 or Hurricane Katrina, we see a pattern. Stressful life events and uncertainty about the future can lead to an increase in alcohol consumption. And COVID had all of that and more. In addition to the emotional strain, we had the quarantine effect, isolation, job loss, disrupted sleep, and the inability to separate parenting from work, especially for parents working from home while caring for kids around the clock. This created the perfect storm. A recent study published in the Preventive Medicine Journal backs this up. It surveyed nearly 6,000 adults nationwide during the early months of the pandemic, and here is what it found. People who already drank alcohol increased their intake by 29%. 33% of women increased their drinking, compared to 24% of men. Those under 40 were the most likely to drink more. Higher education levels, suburban or urban living, and a history of anxiety or depression were all linked to higher alcohol use. And on top of all this, many treatment programs and support groups shut down or moved online, leaving people in recovery more isolated than ever. For many, this led to relapse. Dr. Jeffrey Reynolds, president of the Family and Children's Association in Long Island, summed it up perfectly. He said, combine anxiety, depression, and uncertainty with the ability to have alcohol delivered to your doorstep in under an hour, and you've got a perfect recipe for alcohol dependence. And he's right. During the height of the lockdown, wine memes were everywhere. Virtual happy hours started earlier and earlier, and the quarantini became the drink of the pandemic. But here's the reality. The effects of this spike are still unfolding. We're seeing more injuries with car crashes, alcohol poisoning, and risky behavior. And we're also beginning to see increased cases of heart disease, liver failure, depression, and alcohol-related cancers like breast cancer, colon cancer, and throat cancer. Well, that's it for today. Join me next week. We will look at what's new in 2025 with alcohol use disorder.